Welcome to the channel, everyone. Today I'm with Ali, and we're going to be talking everything about PT school, health and wellness, all the things. So, Ali, without further ado, tell us a little bit about yourself, your background, your journey.
To- Totally. Well, I'm very happy to be here. Appreciate it all the time. So, little background about me is I'm currently a third year physical therapy student, and I'm planning to graduate in November. I went to Loyola University Chicago, where I majored in exercise science. And as for PT school, I'm currently attending Rosalind Franklin University of Medicine and Science. I guess what I want to introduce is I'm planning to go into an orthopedic residency upon graduation because I see myself opening my own private practice one day, and I really want to specialize in that area. But a little like personal background about me is I'm someone who is very much enthusiastic about anatomy, exercise, wellness, and I got into physical therapy because it was a way for me to implement an active healthcare model to teach people how to go into taking care of their own health. So that's a little background.
Yeah, that's awesome. Thank you for sharing your journey up until this point. Was there a specific point in time where you knew you wanted to do physical therapy? Was there like any injury or like any story, or you just kind of always knew that physical therapy was for you?
So I definitely did not know about physical therapy until probably my junior year of college, actually, because I was on the pre-med track,
Okay.
planning to go into be a physician, med school. Had a job at a medical clinic, realized it was not for me. I'm someone who really values getting to know people, long interactions, less of the computer documentation work, and more getting to know the patient, really getting down to the root cause of what's going on. I
Yeah.
saw what the doctor's life is like. It's more behind a desk computer, very little time with patients. Realized it wasn't for me.
Mhm.
And as far as like if there was an injury that set me for it, personally, I've actually never had an injury that made me need to get physical therapy. Knock on wood. Hopefully that
Yeah.
stays the case. But actually, in my sophomore year of college, my brother was hospitalized because he had meningitis. And after about a month of being hospitalized, leg atrophy, really weak legs, hardly was able to get up and walk. So he needed to attend physical therapy for it. And it was really groundbreaking for me because someone who really likes exercise and tying in the science behind anatomy and different exercise principles, and to see that there's a profession where you use exercise as a prescription for medicine really got me interested. So I attended his sessions, got to see how the physical therapist is altering things like joint angles to affect the muscles being used or biasing certain avoidance of compensations, and to recognize there's a real big science behind all those little fine tunings to how it affects your movement. It was just really fascinating to me.
Yeah.
And beyond that, I believe like my strengths is being able to communicate with people, educate, build rapport, and tying that with my interest, which is about the human body, exercise, especially my background as a personal trainer. It was a profession that my strengths and interests combined, and I was able, again, like I said earlier, to teach people a healthcare model that teaches them to take an active role to improve their health. I'm big on prevention and education, so all of this together is what wanted me to pursue physical therapy.
How has your background as a personal trainer helped you to embody that, take that approach throughout PT school?
So, with my background as a personal trainer, I get to spend a lot of time with people. I was spending about 30 minutes or even up to an hour one on one. Because when I graduated college, that was in 2022, I didn't start PT school right away. I took a gap year, and during that time, I was working in a medical fitness center as a personal trainer fitness specialist. And my experience as a personal trainer, it didn't just teach me the importance to educate people why they need to move, why they needs to adopt new lifestyle habits, but it actually made me appreciate there's different determinants of health. I got to see what their social life is like, got to see what their mental health is like, see if they have a good support system. Because when I graduated college, it made me think more closed-minded that movement is movement, focus just on the physical, biological components. But being a personal trainer, getting to connect with people, seeing that they have stressful times or that maybe they don't have a good support system, there's other social determinants of health at play, etc., made me realize that the human body and movement, it is so much more complex than just the biological component. I mean, it goes to show why in PT school they explain the biopsychosocial social model, but that's another discussion.
Yeah.
Overall, like tying that in, my background as a personal trainer helped me to appreciate there's more determinants of health that just go beyond the physical. And with physical therapy, because we're talking with the patient, getting to know them, building that rapport, it's another way to make them feel better without it being strictly through exercise or physical means. I mean, I'll never forget when a professor told me that just having a good conversation with someone, making them feel better already makes them like 10 to 20% better without having to do any physical work at all. And like it really resonates with me because that's exactly how I felt when I was a personal trainer.
Yeah, I love that, the 10 to 20%, because that is such a big part of the job, like building relationships with people, especially in like an outpatient setting. If you are able to just get to know them, get to know their goals, make it specific for their goals is such a big thing that I'm seeing even now as a PT. And I think having a background as a personal trainer is like very helpful for like in that regard, getting like becoming a PT.
Yeah. And I'll add like when you're a personal trainer, you don't just look at like deciding on exercises, but you appreciate what's their nutrition like? Is that actually affecting their plan of care? Because for the longest time in physical therapy, we were thinking that, okay, their shoulder hurts, their hip hurts, knee hurts. Let's look up the chain, see what's going on. But also, my experience as a personal trainer, I know people tend to fall in that trap that more is better. So I always keep that question in my head. Have you upped your workout volume a lot recently? Have you done a new routine you weren't ready for? Can I see how you bench press, how you do pull-ups, etc.? And even then, I ask about their nutrition. If they're not get, obviously, I can't, as a physical therapist, give any specific nutrition guidelines. But if my experience as a personal trainer helps me know that a lot of people are deficient in lots of nutrients, which can cause plateaus in strength or certain bone changes or other deficiencies that could explain their joint pain. Is that always the case? No, but it's a good thought to have in my head that I can rule other things out.
Yeah. Those are great points. And I love that you mentioned like treating the whole body from like a nutrition standpoint, stresses outside of life. Do you want to take the route of going cash based?
I mean, I don't want to like get in trouble for saying this, anything like that, but this is just my personal opinion.
Yeah.
But I am a strong believer that insurance companies are a barrier to healthcare and they don't give true access. The reason I say that, and I did talk about this with Odell Miller, it's that in PT school, we're taught a lot that insurance companies, it's part of the role, it's just part of the profession. And we are expected that you have to deal with the fact they won't approve your number of visits. They may not approve it if you don't write your note a certain way. If their referral says it's for back pain and you're like doing an evaluation and now you think it's stemming from the hip, yep, can't treat it. They got to go back to the doctor, get the referral hip, and then they got to come back again. And that's weeks where it could progress to the chronic stage.
Mhm.
And to me, when I saw Odell's clinic, to know that he goes strictly cash based, literally, if a patient is next day not feeling too well, you can just text them and be like, "Can I come in?" And he's, "Yeah, totally. I have an opening." To see it be that easy, or just similar with direct access. There's no referral needed. You can walk in and he can immediately start. And there's no such thing as the 8-minute rule in his place, which I
Yeah.
do think that's another barrier because
Yeah.
not everyone does need the manual therapy or need the exercise specifically. Maybe they need a different blend of it, different amounts. Insurance companies don't know that. They don't have the medical clinical reasoning behind these things. And when I saw him interacting with his patients, I kid you not, he was about spending an hour and a half roughly with each patient. And some of the patients, it was all exercise, some was all manual therapy, some was a mix of those, but he was never once looking at the clock needing to do 8 minutes. He constantly told me, no, I give them what they need. And if he believes upon their initial session that they could benefit more from the manual therapy before exercise or vice versa, that's what he's going to do. And people are willing to pay that because it's what's missing in the profession. Lots of people, I feel, are very much annoyed with physical therapy because they believe it doesn't work. But I think the reason it doesn't work is because the plan of care is being dictated by a third party that doesn't have the medical knowledge or the reasoning skills to control the treatment. And then that's why people don't get better. But you go to a clinic like a cash-based one where people are willing to pay, and you get the exact number of sessions that the physical therapist decides you do need. You get the treatment they know you need, and you get that one-on-one care. You're not juggling between the aides and this PT and that.
Yeah.
And even then, the physical therapists themselves, they don't get burnt out, which
Yeah.
I feel it's very much underrepresented in the profession. And
Mhm.
where I want to go with all of that, because my history as a personal trainer, and even just me as a person, I'm a very thorough person when it comes to doing an assessment, getting to know people, etc. Because I've helped friends or family if they got like, a nagging pain, this
Yeah.
and that. Or in my first rotation, when I was allowed to take a long time with patients, I had so much positive feedback, so much value, and so much success with those people when I had like hour to hour and a half. And physical therapists are telling me, you do have to get faster at this because you're not going to have that time all the time.
Mhm.
But in my head, I'm thinking if I were going to go the standard
Yeah.
route, yes, but I'm
Yeah.
not going the standard route because this is what sets me apart. This is what I feel my strength is, and I don't want to lose it. So that's why I really want to go into something similar to what Odell did.
Yeah. I love that response. And I think there's so much like freedom that you have going cash based and the ability to get to know them if like the beginning of your whole like initial eval is just getting to know them, getting to like make it personalized and build a relationship that gives you the freedom to do that. Whereas like it almost feels like you're checking off boxes being in the insurance model.
Mhm.
And I will say too, like I think the insurance model works for some settings more than others, like inpatient acute care. Sure, it's great for
Definitely.
that, but there that's the thing. Like we're operating in the gray in this profession. So I think in some regards it's very helpful.
No, absolutely. And I agree. You're right. There's definitely a time and place for it. And I won't say that insurance companies shouldn't exist because tell
Yeah.
people, like you said, in an acute care setting, if they have to pay out of pocket, no, that's a fiasco waiting to happen.
Yeah.
And I really want to take the moment to appreciate, like, from the PT's perspective. It's one thing that the standard route does tend to do more harm to the patient. But even then, with physical therapists, to tell them you're going to see roughly 15 to 20 patients a day, and you have to keep up with all your notes, document the way the insurance companies want you to do it exactly. And not to mention that there's only so many hours in the day, and you're expected to have the same level of empathy, level of thorough evaluation, going to every single patient, and you do that every day. It's no wonder that I don't know if I'm right about this, but if I remember correctly, I think the statistic is somewhere around 60% of new graduate PTs getting burnt out just 2 to 3 years after they graduate.
Yeah.
And it makes sense. It's unfortunate because that happens. PTs tend to get underpaid when they're on the insurance route, and there just needs to be a change. And so I don't want to be a part of a system that I feel is broken. I want to be the difference I think is needed.
Yeah. For sure. And being like on the other side of it now, there are like some private practices where they offer one-on-one care. Like I'm at one now, and you
Mhm.
really just have to do your research because they're out there and like that ability to just be one-on-one with someone for 45 minutes is great. So there's different like ways to go about it if you don't want to have your own cash practice, but that's awesome that you're taking that route. You're taking the initiative by going into an orthopedic residency and you're doing all the right things.
Thank you.
So, what are some ways that you've started? You mentioned in the video too, in the YouTube video, that you were starting to network as a student, starting to lay the foundation for building your cash practice. What are some of those steps that you've taken and things that you've done?
Yeah. So I will say this. Biggest determinant is going to make sure that like you have at least a not horrible starts to running a cash practice because no one is going to start their cash practice with it being purely successful. There's going to
Yeah.
be that struggle stage at first.
Yeah.
But the way I think that you can at least make it not as bad is yes, you do have to network because you have to have people who are willing to come and pay. I'm a firm believer that I think during PT school, a lot of students make the mistake that they only spend their time studying and like getting like the highest grades possible and like they have to get the 4.0, everything like that. I would rather spend like a good amount of my time focusing on that, but I have to devote time to networking. And how I've networked is for one thing, I mentioned before I started PT school, I worked in a medical fitness center. I'm still in contact with those people. And the people who attend that center, it's not just the standard weekend warriors. It's people who get referrals from their doctors to work out for different chronic conditions. Those people, they need physical therapy all the time. So I'm staying in touch with that place. So then they could help with like referral, or they know my name if they ever want to recommend people for physical therapy. That's one. Second, while I'm in PT school, we have had a lot of volunteer opportunities to treat local high school players or local sports, local like miniature sports teams, those sorts of things. I volunteer for every single one. So again, I could like, make my name more well known. I'm really passionate about this population, or I'm very present in this particular area, those sorts of things. So again, it just raises awareness on my skills and what I want to do so people remember me more.
Yeah.
I started recently a new job at a wellness space that's very close to where I live. It's organized by a friend of my dad, and they have people come. Again, it's like a cash-based thing.
Yeah.
People go there, they're willing to pay again. And I starting a job there. I'm giving like people little deets about physical therapy, the intrinsic muscle control, how the body's controlled, all this stuff.
Mhm.
So by the time I graduate, I would have built another rapport with those people. They'd be willing to come because those are people that are very active themselves. They like to take care of their body, so they'd also be willing to pay.
Yeah.
And then the thing is, before I graduated college, like this was when I was still thinking I was going to go on the doctor route. I
Mhm.
was working in a medical clinic, and I have friends who are doctors there. They're referring people physical therapy all the time. And
Yeah.
all these locations I mentioned, they are around the area I do plan to stay. So me staying in touch with all those is a great way for me to like have referral sources. That's how I've networked.
Yeah.
Just really any opportunity I can get where it's in my area and there are people who they're very active themselves, they care about their body, they're also in the medical field, or even if it's just like a fitness center nearby, it goes a long way. It really does. Because big mistake you can make when starting a cash based is doing it where no one knows you, because then you need to have your outcomes or your skills be the reason why they're going to pay. And my purpose for networking is showing people I'm passionate about this, I know what I'm doing, and like I won't let you down because then they'll remember me and then they'll come.
Yeah. That's awesome that you're planting those seeds because you never know, someone might know someone. It's not always the person
Mhm.
like you connect with, but just having those like doing those networking opportunities is going to open so many doors in the future. So that's awesome that
Mhm.
you're doing that.
Totally. And even then, I mean, in school right now, I mean, I have friends in my school's podiatry program and my physician assistant program. Now, I don't treat them in isolation. Obviously, like I'm not licensed yet, but we've had school events where say people come while we're being supervised by physical therapists. We can treat students or faculty. I've had podiatry students, I've had PA students come and I got to treat them, and then they're like feeling so much better. That's another referral source because when they graduate, they're also going to be referring patients for physical therapy. So I'm trying to like stay in touch with them, and anytime my school organizes those events, I keep attending them. So I just like make it more well known.
Yeah, that's awesome. Going into a little bit more about PT school, how have you been able to manage your time as a PT student, like life outside of PT school, and then also being a personal trainer? So like more along the entrepreneurship route, how have you been able to manage all of that?
So it's definitely been very, very difficult. For one thing, my program's accelerated. Most physical therapy programs are 3 years long, and mine is 2.5.
Wow.
And we get on average 1 to 2 exams every week.
Wow.
So it's very fast paced. And on top of that, I'm doing a dual degree. So I'm studying to
Wow.
be doctor of physical therapy, and I'm also studying to get my master's in health administration at the same time.
Wow.
So things that have helped me is I've moved on campus, so I've had been on their student housing the past 2 years.
Okay.
I got total control of my time. I lived alone, so I didn't have any commitments, anything like that,
Mhm.
meaning I was able to devote as much time as I could to my studies, and it helped me tremendously.
Mhm.
Two was I did set a routine for me. I'd wake up a certain time, I'd go to bed a certain time. This is when I would work out. This is when I would handle this subject, etc. Because I'm a type of person, I really function well from having a routine and I can stick with it. I don't like unpredictability.
Mhm.
And when it comes to my classes, I would do it based on what I know are my areas of weakness. For example, my background as a personal trainer, I learned a lot about anatomy, about exercise selection and modification when it comes to knowing their actions, the structure, physiology, basic exercise principles, etc. We took lots of classes on those. And if at the same time we were doing those, we were also doing classes with neuro or pediatrics, how I would organize my studying would be okay, based on my background, my areas of strength, I should spend the least time on this and I should spend more time on that. Because I feel most students try to do even blend on different subjects. No, I'm a firm believer, just spend it on the time that you know is your area of weakness. And for me, it would be things like neuro or pediatrics because I don't have as much exposure. And as far as it goes, I mean, balancing with personal training and then entrepreneurship, I wouldn't consider myself a full-on entrepreneur. I'm probably more of an amateur at the time, though I really am trying to balance more on my social media game. And how I was able to balance that was if I'm working out, I'm just going to film a lot of clips of my workouts. So that way I'm not taking extra time out of my day. I'm just filming what I'm doing. So later on in the day, later on in the week, I could look back at those clips, make some kind of reel out of it. I could film myself studying while I'm still studying. Again, I'm not taking time out of my day. And I could do the same thing, look back at the clips and see what kind of reel I can make out of those. Here and there, I could post things on life lately. The idea is that I would film myself doing what I'm normally doing. So I'm not taking extra time out of my day.
Yeah.
Though I would organize when I'm having breaks or I'm having less busy weeks, that's when I would take the extra time to, say, check up on personal training clients, or I would film extra content. Overall, it's that I give myself a routine every day and I have to stick with it. And then when there are the weeks where I'm on break or there's less time, less exams, that's when I would take advantage of it and be, okay, I have more time now. Now let's do the things that are a bit more time consuming.
Yeah. Those are awesome points. And it sounds like you're very adaptable to like, especially being in an accelerated program, like you have your routine, but then you're also willing to like adapt when you have less time and more time. So that's awesome that you're able to balance all of that.
hmm And I mean, I will say with me personally, my struggle, I have no issue talking about this, but I was born with a learning disability. I did have like special ed classes growing up. I didn't need them anymore soon as I was halfway in high school. Though still today, it's that some subjects they come much easier for me and others come much harder. For example, in PT school, when we were in the cadaver lab, when we were learning clinical anatomy, when we were in advanced regional anatomy, when we were learning kinesiology, orthopedics, all that kind of stuff, I got exposed to a lot of it, both through college, being majored in exercise science, and when I was taking my gap year working as a personal trainer. And I watch YouTube videos all the time about orthopedics, exercise, fitness content, health, etc. Because I had that repetition and just that very high exposure, it made doing those classes so much easier for me. And I was like, and I was accelerating so high with it. But then with topics that I'm not as familiar with, such as with acute care, cardio and pulm, or pediatrics or neuro, I wasn't doing bad. I was just doing more like say average or slightly above average, but I definitely wasn't excelling as the other things.
Mhm.
So the struggle with me in an accelerated program, it's that I need very high repetition and long exposure for a topic before it's really solidified in my head.
Mhm.
That came easier for some than for others, but that's just how I am personally.
Mhm.
And the big lesson I told myself is, okay, as soon as you graduate, just devote time each day to review the things you're not as confident because you know you're the type of person that just needs very high exposure and there's nothing wrong with it.
Yeah. No. What advice would you're a third year PT student, what
Mhm.
advice would you give to someone who's about to start PT school or is just starting out in their first year?
Mhm. So I would give it three. My first point being study to learn the material, don't study to get an A. Now, I'll elaborate on that. It goes into a point I did make a few discussions ago. I feel a lot of PT students are obsessing so much about they want to get the A. They feel that their grades are a strong indicator that they are going to be a fantastic PT. I do disagree. I'm not saying if you get all A's, you're going to be a bad PT. You can definitely be a great PT if you do.
Mhm.
I feel that there is a difference between studying to get a good grade on a test versus studying to truly learn and actually be able to apply the material. So that's the first point I would make is refocus your study to where how do I learn this material so it stays in my head and I can apply and I can comprehend it rather than let's just study this material in the short term so I can get the A and then forget about it later. That's the first point. The second point is that you want to know how you best learn. Some people, they like to watch the pre-recorded lectures. Some people like to draw the big diagrams on the whiteboard. Some people like to do flashcards. Some people like to study with groups of people. I'm not one of those people.
Yeah.
You just have to know which one you are. And if you don't, spend your first term in PT school trying different things, see what works, see what doesn't. So that way, the rest of your PT school career, you know what's going to click more efficiently. Because I feel when people don't know how they best learn and they hear all the time, no, research says this is the best way to gain repetition, but that works for the vast majority. There's always the chance you could be the outlier. So you got to be honest with yourself. I mean,
Yeah.
me personally, I actually learned best not taking notes in class and just sitting and like listening to professor, being very engaged with the discussion. Then later on, I would review the PowerPoint and I would actually rewatch the lecture and 1.5 or 2 times speed and then watch it twice. So the normal time it takes to watch one lecture, it would take I would see it 2 times. I mean, that's what worked for me. Some people say like, how did you do that? How could you even listen? Hey, it
Yeah.
worked for me. You just got to figure out what works for you, you know?
Yeah.
And then the third point, man, I almost forgot. Oh, okay. It is having your own routine. Some people they want to take it day by day, which nothing's wrong with that. If you notice, hey, I got an hour, okay, let me study. That works for you. Go ahead. If you're like me and you prefer to have a set routine, then I do recommend you do that. But above all is every term in PT school is going to be different, whether it be one has a big comprehensive exam coming, one is more focused on a topic you're not as familiar with or you're more familiar with, or maybe one is gonna time you're gonna have a term where maybe something in life came up, personal or otherwise. You have to be able to adapt. And earlier I did mention I focus less on my strengths and more on my weaknesses. That's how you adapt is you analyze the situation and be like, okay, what's the topic or what's the struggle going on right now? That's what I have to devote the most time on. And what am I more confident on? Let's worry less about that. But overall, those are the three big points I would say. Study to learn the material, not to just get a quick A. And you have to know how you best learn. Take the time to try different things, analyze, see what works, see what doesn't, and be adaptable. Like knowing your circumstances of the situation and being able to do that repeatedly, turn by turn.
Those are awesome tips. Thank you so much for sharing those.